Okay, hello friends, myself Dr. Sanjeet Kumar. Today we are going to start postmortem examination. Other names of postmortem examination is autopsy, necropsy, obduction and autopsia cadavarum. Definition: it is a type of external and internal examination of the dead body to find out the actual cause of death. History: first autopsy done by Virchow in Italy 1302. First medicolegal autopsy in India done at Chennai by Edward Berkeley in arsenic poisoning. Types of autopsy: the first is medicolegal autopsy or forensic autopsy. Features: done in unnatural death. Most common in India, medical autopsy. Done to find out the cause and the manner of death. Done by forensic expert. Authorization given by the investigating officer. Relative consent is not necessary. After completion of the postmortem examination, the body will be handed over to the IU. Second, clinical, pathological, academic or hospital autopsy. Done for natural death. Done by pathologist to know the medical background. Relative consent is mandatory. Aim to find morphological changes explaining clinical features and the effectiveness of the treatment. Then third is virtual autopsy or Virtopsy. Whole body imaging is done to know the cause of death. Then fourth, psychological autopsy or verbal autopsy, done to find out the mental status of the victim. Done in suicide case. Done by the interview with the parents and the friends. Then negative autopsy. Features: after dissection, chemical analysis and the histopathological examination, the cause of death cannot be found. This is called negative autopsy. Obscure autopsy, when the gross finding is minimal or inconclusive. Then rules of medicolegal autopsy: conducted when the written order from the police or magistrate. Postmortem should be performed as soon as possible after receiving requisition letter. Dead body challan, inquest report and command must be verified before proceeding for autopsy without undue delay. Then done in daylight, but there is no law which prevent the autopsy being conducted during night. Autopsy is conducted in mortuary. The body must be identified by the police personnel who accompanies the dead body and one relative of the deceased. Identify the body must be recorded with their signature. In unknown bodies, the mark of identification, photographs, fingerprints, height, color of scalp hair, pubic hair and the body hair should be noted. Done by RMP with training in FMT. No unauthorized person should be present at autopsy room. If there is discrepancy in the injuries noted in inquest report and those found on the body, the IU should be shown the injury so that the necessary correction must be made in the inquest report. Difference in the injuries in the wound certificate and autopsy report benefit accused. Autopsy must be complete and the whole body should be examined. All the body cavities should be opened and every organ must be examined. Doctors should record all the positive and negative findings. In case of poisoning, preserve viscera and send to FSL for the toxicological analysis. The postmortem examination report made in triplicate, one for IU, second for SP or magistrate and third is office copy. Postmortem report should not be issued for the party. After autopsy is complete, body is handed over to IU. The postmortem finding should not be discussed with any unauthorized person but should provide all the facilities to the investigating officer. Interested parties requiring a copy of PM report should apply to the concerned magistrate or IU, without which the doctor should not furnish the report directly to any third party. If no objection certificate given by IU or magistrate, only then photocopy of the office record copy of the PM report may be given to legal hires. Then types of skin incision: eye incision. Incision is given from chin to pubic symphysis. It is the most common type of skin incision. Umbilicus is as it consists of dense fibrous tissue which is difficult to stitch. By incision starts from both shoulders close to the acromion process. It extends down to below the breast and meet at the GP sternum, and from GP sternum to pubic symphysis. By incision, then modified by incision. Incision start from both sides of mastoid process, then meet in the supraesternal notch and continue to pubic symphysis. This is modified by incision. Then T incision. Incision starts from one shoulder and moves to the another shoulder, and from midpoint of intershoulder line to the pubic symphysis. This is T incision. Then X incision. Incision on the back of the body. One vertical midline incision is given over the vertebral column. This is midline vertical incision. Then from the upper end of the vertical incision, the two lateral transverse incisions are given, one on along the superior border of scapula. This is two transverse incision over the superior border of scapula, and from the lower end of vertical incision, two lateral incision are given on either side of gluteal region. This is the two lateral incision given on the gluteal region. This is called X incision, preferred in custodial death. Then inverted by incision from chin to umbilicus. Then two limbs go down to inguinal region on both sides, done in fetus and newborn. Chin to umbilicus, and then from umbilicus to both sides inguinal region. Then technique of organ removal, Virchow method or organ by organ method. This is the most common method. Advantage is it is cube. Disadvantage, continuity is lost. Multiple organs cannot be studied together. This is a disadvantage. In situ or Rokitansky method, features done inside the body itself, done in infections like HIV, hepatitis B, radiation, and in children. Advantage, it is very quick, contamination chance is greatly reduced. Disadvantage, detail cannot be studied. Then in block or Ghon's method, particular region is explored at a time. Advantage, inter-organ relation is retained. Disadvantage, relation with other organs is lost. Then in mass or Lettule method, all organs are removed at a time. This is very quick, retained continuity. A disadvantage is dissection of organ is time consuming. Cavity to start with. In poisoning case, start from the cranial cavity because we may immediately smell the presence of volatile poisonous substance like ethanol and cyanide. So in poisoning case, we have to open cranial cavity first. Then in newborn, start from the abdominal cavity to check the level of diaphragm. If lower levels, means baby respired before death and vice versa. Then in asphyxial death, sequence is first cranial cavity, then abdominal cavity, then thorax, then neck. Neck is in the last to achieve the bloodless dissection of neck. Then Prinsloo Gordon artifact, oozing of venous blood with a prior dissection of the skin of the neck. It may resemble traumatic bruise. Then air embolism is called underwater autopsy. Pericardium cut open and filled with water, then ventricles open. In case of air embolism, air bubbles are seen. Then Pyrogallol test, ventricle is aspirated by syringe with Pyrogallol solution. In case of air embolism, brown color is seen. Procedure, 4 ml of 2% freshly prepared Pyrogallol solution is collected into 2 10 ml syringe. To the first syringe, 4 drops of 0.5 m sodium hydroxide solution is added, then the gas is aspirated from the right side of heart. The needle is removed and replaced with a stopper, and the syringe is shaken. If the air is present, the mixture turns brown. In the second syringe, some air is introduced and the test repeated as a control, so it turns brown. This test helps to differentiate gas present in the heart from the gas formed due to decomposition. Then pneumothorax, chest cavity is opened first. A skin flap is reflected in thorax and filled with water. Then puncture the pleural cavity with surgical blade. In case of pneumothorax, air bubble is seen. Normal case, thoracic cavity is open first. Dissection of organ, heart, inflow outflow method, that is flow of blood, flow direction, like right atrium, then right ventricle, then left atrium, then left ventricle. Brain, coronal cutting method. A spinal cord, not done routinely. If done, posterior dissection is best. A stomach, double ligation technique, open along the greater curvature. A small intestine, open along the mesenteric border. Large intestine along the anterior tinea. Liver by multiple parallel cuts. Autopsy report, there are 3 parts of autopsy report: preamble, introduction, or preface of report, containing details of the deceased, details of the investigating officer who accompanied the deceased, details of the doctor, relative details. Then body of the report consists of complete description of external and internal examination of body. Then opinion or conclusion consists of nature of injuries, either antemortem or postmortem, cause of injuries, cause of death, time since death, any additional information if available. The autopsy report must be in detail, comprehensive, objective, honest and scientific. At last, the signature and the qualification of the doctor. Nothing should be erased and all alterations should be initialed. This is the sample of postmortem report. Then medical importance of autopsy. To know the cause of death, identification of unclaimed body, to know the manner of death, to estimate the time since death, to correlate with the antemortem diagnosis, for fetus to find its age and viability, to identify unrelated or new disease, to find genetic disease, to collect physical evidence in order to identify the objects causing death and identify the criminals, to retain relevant organs and tissues as evidence, the types and nature of the weapon used, a relative position of the victim and the assailant at the material moment of causation of injuries, explain about whether the injuries were self-inflicted, defense wound or signs of a struggle and resistance. In presence of multiple injuries, tells about the number of assailants, tells about whether the injuries enhance the existing natural disease process leading to death, whether any other offense was involved in case of death like rape, assault, whether dead body has been displaced from original place of the disposal. These are the medical importance. Then important question related to postmortem examination. At autopsy, heart should be opened underwater to confirm fat embolism, air embolism, confirm myocardial infarction, confirm constructive pericarditis. So confirm air embolism. Then postmortem in a newborn baby is done by opening first skull, chest cavity, abdominal cavity or any of the above. Abdominal cavity to see the level of diaphragm. Most common types of autopsy done in India is medical autopsy, pathological autopsy, psychological autopsy, virtual autopsy. So medical autopsy. Which one is not true during pathological autopsy? Done by pathologist, relative consent is not mandatory to know the medical background done in natural death. So not true, the relative consent is mandatory here, this is wrong. Which type of skin incision is given in fetus during postmortem? I incision, by incision, modified by incision, inverted by incision, Which one is most common method of organ removal during autopsy? Ghon's method, Lettule method, Rokitansky method or Virchow method. The Virchow method is the most common method for organ removal. This is all about autopsy. It's a very important topic for Viva. Okay, thank you for watching.